Good afternoon, and welcome to Can Cable TV 21. Hello, my name is Lucy Aquino, and I am the Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center. And today you'll be watching a live show. We do have our lines that are open, numbers at the bottom of your screen. So during the show, if you have any questions, please give us a call. For the next 25 minutes, we're going to be discussing hard decisions about cancer treatment and care. We invite you to call in with your questions. Joining me today is Dr. Mebea Aklilu, Hematologist and Oncologist Specialist at Illinois Masonic Medical Center with the Advanced Center for Specialty Care. Please allow me to welcome you to the show, and thank you.
Thank you for having me.
Dr. Aklilu, the diagnosis of cancer, many people understandably want to pull out all the stops when they receive a diagnosis of cancer. But some tests sometimes and procedures are not necessarily always good for them and can actually be harmful. And what does that actually mean?
So I think the way to think about it, the diagnosis of cancer or the fear of cancer is a real psychological blow. It's just not just a diagnosis of the body. When you hear the word cancer, it has a different meaning. But one thing we do know about cancer is that sometimes not all cancers are dangerous, and not all cancers need to be treated immediately, and that the diagnosis of the cancer is fraught with many problems, and is not 100% precise. A good example is breast cancer screening. So women should get mammograms, has been what we've talked about. But I think it's just recognized that mammograms are imprecise sometimes, and you have to understand that if you're going to do it, that you're going to get a lot of what we call false positives. Abnormalities that are really just normal and benign, but they will cause you to get extra testing, including invasive procedures that you may not necessarily need it. And so I think that it's not an easy decision, or it's not a precise science, and that's what I think frustrates people.
Right. Yeah, and it is a scary thing to hear. So obviously, when you hear something like that, I mean, I can't imagine how I would react, and but at the same time, I can only if I was to think about it, I'm not sure what I would do and how to really react on that. So, Dr. Aklilu, what causes cancer? I mean, you hear all kinds of things out there, but what really causes cancer?
So if I could really answer that question for you, I would win the Nobel Prize right here. And so that really tells you the difficulty of cancer. Cancer, first of all, is hundreds of different things that we lump into one thing called cancer. Even when you think about lung cancer, there's several different things that encompass lung cancer. And so cancer is just a normal cell that somehow has become an abnormal cell. And that switch from normal to abnormal is what we're really working on. And to this day, we haven't figured out what that switch really is.
And do you think that with modern technology today, is that around the corner anytime soon where they might find a cure for cancer?
Well, if you look at where we were 100 years ago to now, I think that we've come a long way. And to give you an idea of the difficulty of it, let's say you and I have pneumonia. You have a pneumonia is caused by bacteria. And if you look under the microscope to the bacteria that I have and the bacteria that you have, if they're similar, they're going to act very similarly. They're going to look similarly, and we're going to look at their genes, and their genes would be very similar. Let's say you and I have lung cancer. You have lung cancer, and I have lung cancer. And it's the same type of lung cancer. But you look under the microscope and you look at the genes, they have absolutely nothing similar to each other. They're as different as somebody else's. And so even if it's the same cancer, it's different. And that's because it changes all the time. If you look at it a few months from now, the lung cancer that I had will be completely different, look completely different, have different genes that it has. And so it tells you that constant change and that constant growth, and that's what cancer is, constant uncontrolled growth and change. That's just chaotic change. That causes difficulty for us to find a cure or a treatment.
So who gets cancer? I mean, does everyone get cancer? Obviously not. But is it percentage-wise? Is it particular cultures, particular populations? where you live, country. I mean, who gets cancer?
You know, there are certain cancers that there are highest risks of in certain countries.
Mm-hmm.
If you look at a worldwide problem, the risks, hepatitis is a huge problem in the world. And so people who have hepatitis in B and C, they are at risk of forming liver cancer. We know there's an association with that. So people in East Asia where their hepatitis is endemic, and people who get it pass it on to their children and they have hepatitis as well, they're at risk of liver cancer. They have a higher rate of stomach cancers and other cancers that are associated with environmental exposures to those areas. So yes, certain cancers are associated with certain countries or certain regions of the world that is associated with lifestyle, associated with environment, certain certain genes that we have.
Right.
Other risks that we really know about are family history. There are family histories that are associated within our population. If you have somebody who has breast cancer, if your mom had breast cancer and her mom had breast cancer, then you're at risk of having breast cancer. Other things that we know are smoking.
Right.
Smoking is a huge worldwide population. If you could do one thing in this world that could make cancer kind of go down
Right.
significantly,
Right.
I would be just smoking.
Stop smoking.
I mean, that is the one
Wow.
thing that you could do.
Wow.
But we also know there are other links. Exercise,
Right.
obesity. These are all things that are somehow linked to it. But not everybody who smokes gets cancer.
Right.
Not everybody who has a family history gets cancer.
Right.
Not everybody who lives in Asia gets liver
Right.
cancer or
Right.
who has hepatitis.
Right.
And so it's not just one thing, and that's a difficulty. So it takes a few problems. You have to have some form of a predisposition plus something else,
Right.
and that something else is still something for us to work on.
Wow. So, but obviously, with the diseases that are out there, and as you mentioned, smoking and obesity and some of these other things, those are the things that can help to bring down the numbers tremendously.
Absolutely.
So how do you prevent cancer?
So I think that's one thing to do. I think the way you prevent cancer is you try to get rid of the known things that cause cancer. I can't say it enough. Don't smoke. I mean, if you can see the people that come into my cancer clinic, and if you look at the number of smokers, active or ex-smokers, it is close to 90-95%.
Wow.
And so there is an association with that. There's clear association with that.
Right.
But I think recently we're also learning about how the lack of diet or the lack of exercise and an improper diet also leads to people to be predisposed to that. Remember, it's something that you're born with or something that you have plus something else. And you got to make that something else minimize as much as possible.
Right.
And so I think that low-tech things that you can control, your environment, getting rid of smoking, and making sure that your diet is as healthy as possible,
Right.
that you're exercising as much as you can.
Right.
Those are the kind of things that have been shown to reduce the risk of cancer, and people are just healthier. And it's just good living. It makes sense.
Absolutely, absolutely. So for our viewers, for those of you who are just joining us, my name is Lucy Aquino, and I am with Advocate Illinois Masonic Hospital with Hispanocare. And joining me today is Dr. Aklilu, hematologist, oncologist specialist with Illinois Masonic Medical Center and the Advanced Center for Specialty Care. I also remind our viewers that our lines are open. If you have any questions for Dr. Aklilu or myself, please, the number's at the bottom of your screen. Please give us a call. Dr. Aklilu, as we're talking about smoking and prevention and all of that of cancer, now there's always obviously that big story of secondhand smokers and secondhand smoking and contact. Is that really more dangerous than actually smoking, the smoker themselves? I mean, you hear all these different things.
I think it's not clear the risk of the secondhand smoker, but it's not as benign as we thought that it was. So I think that there are certain exposures, and it depends on the degree of exposure that you have. But I think that there is a risk associated with secondhand smoke. And so I think that if you grow up from childhood with people actively smoking around you and your exposure is dense, that you're really exposed to it for a long period of time during your developmental periods, I think the risk is real. But have we figured that out 100%, what the risk is as much as we have with smoking? How much does it raise it if you're not there? We're not there yet. We're not there yet. But I think that personally, as a human being, as a rational thinker, I think there is a real concern for secondhand smoke.
Absolutely. Wow. So you alluded a little bit earlier to cancer running in families and those getting it, not get it. But is it something that if it does run in the family, you're more inherited to
For certain
cancer,
cancers, like let's say, if lung cancer is, that's always a good example, is one of those cancers that we haven't found a lot of hereditary risk. Its exposure smoking seems to be the biggest exposure to that. And so if you have lung cancer in your family, it doesn't necessarily mean that you will get lung cancer if you're a non-smoker. But breast cancer, there's those are the ones that we see a lot of grouping of. Colon cancer. So again, this comes back to the fact that cancer is several different types and they're all different. But the major ones, the colon cancers, prostate cancers, the breast cancers, those are the ones that seems to have a real kind of association with that.
Absolutely.
But the way I think about it, it's always important to know your own history and your own risks. And I think that knowing your family history and presenting that to your physician is really important.
Right.
And so the physician can look at the groupings of family cancers that are present and try to think, are you at risk?
Right.
And when will you be at risk? At what age will you be at risk? And what should we do about that risk? So I think that's why knowing your family history is really important. To give you an example, people come into our clinic and we talk about their cancer and we talk to them about their family and we say, what did your grandfather die? And, the typical answer is, well, that was so long ago. They died and they didn't know. We don't remember. Or they grew up, they were from another country where medical records are not that known. They died so-and-so, we don't know what happened. But sometimes when they go home and start talking to their aunts and to other people, they realize that there is more family history than they thought.
Yeah, and I always find it interesting too, because even in our Hispanic cultures, one of the things that we like doing, at least I like doing, is that when I'm meeting with family or visiting family, one of the first things I always do is, so if I had 10 aunts and those who have passed away, what they passed away from, and do you know what they passed away from, and jotting down that family history somewhere, and it is going to be important, and even if you don't utilize it, but what if your children need that information in the future?
Absolutely.
That's definitely something to have. I do want to remind our viewers that with me today is Mebea Aklilu, doctor, hematology and oncologist specialist for Center for Advanced Care at Advocate, Illinois Masonic Hospital. And if you have any questions for Dr. Aklilu, you can reach him at 773-296-7180. And later on, I do want to come back because there's this wonderful new building that you have moved into at the Advanced Center for Specialty Care. And it's a state-of-an-art building, and I want to share that with everyone because it's just unbelievable, the new services for community in Illinois Masonic service areas. Unbelievable building, but we'll come back to that. So, Doctor, if there's not, we know there's not a cure, but hopefully we'll get closer to one. But for those individuals coming back, you've been diagnosed, you've been told you have cancer. What are some of the first things you need to do once you hear something like that?
I think when you first get, the first thing is you have to be emotionally prepared for the diagnosis. And so I think that I always say people should marshal the resources around them. Have their family members be present, have them be aware of what's going on. And if you have other kind of communal things that you could do, your church, your other community, your neighborhood, you have to marshal your resources because it's just not a one-person fight.
Right.
The next step is you really have to understand is just really touch base with your primary care physician because that's your gatekeeper. That's the person that you know the best, that knows you the best. And so you have to talk to them and say, all right, I need to get in touch with the best person to fight this cancer that I have. Right. Is that best person a surgeon? Is that best person a medical oncologist like myself who gives chemotherapy? Is that best person a radiation oncologist? Or is the best person a group of all those people that work as a team to fight your cancer? So I think that's the first step. And I think always recognize that your primary care physician should really be an important member of your team. Right. And then they will provide you access to the people that will help fight the cancer for you.
So once you've done that, and obviously treatment will start shortly after you've seen your oncologist, and your oncologist has concurred and has shared that information with your primary care, a plan of action obviously is put into place. Yeah. And during that plan of action, sometimes a question comes up about chemotherapy. Yeah. And Dr. Aklilu, chemotherapy, what is it and how does it work?
Okay. in the old days we used to just say chemotherapy, but now the things that we give are chemotherapy, immunotherapy, or biological therapy. So I'll take each of them at kind of where from the beginning to the third one as well. Chemotherapy is what has traditionally been what we use to fight cancer. And these are drugs that are given intravenously as drips through the vein or orally as pills. And what they are kind of, they target cancer cells. They target things that grow quickly, and they try to kill them because they grow quickly. And chemotherapy, there's hundreds of different kinds of chemotherapies, and they work slightly differently, but they take advantage of the fact that cancer cells grow quickly, and they try to kill things that grow quickly. But there's also things in your body that grow quickly. And this is where the side effects of chemotherapy come into play. And so, it does fight the cancer, but it also fights the normal tissue, and that's where the side effects are. Biological therapy, or what we call the new targeted therapies, are things that we said, well, instead of just targeting things that grow quickly, can we target things about cancer that makes them cancer? What gene is on that is creating some substance that's making this cancer grow? And could we target that specific gene to turn that gene off or stop it from producing its substances that cause difficulty? And so that's what targeted therapies are. They are drugs, again, given intravenously, or most likely as an oral pill, that target those specific things. They do have side effects, but it's much different and much less than the traditional chemotherapies. Immunotherapy is the thing that's a hot topic right now.
Right.
And immunotherapy is how to marshal the body's immune system, how to turn it on. Because cancer is you. It's your cell that's become abnormal. How do we shut that off? How do we make your body recognize that it's not you, it's evil?
Right.
And how do we marshal your immune system to be upregulated or turned on and fight this cancer and kill it without cause? And this is a kind of a new thing that's going on, and we're seeing really wonderful results. But in terms of side effects, it's pretty minimal. And so immunotherapy is what we're hoping would be a future. Biological therapy, immunotherapies. Targeted treatments that help fight the cancer with minimal side effects.
Well, now that you mentioned that, I do want to just share this, and I'm hoping that that the new Center for Advanced Care over at Illinois Masonic Hospital, state-of-the-art building. This is just an unbelievable building. I walked through it the other day, and I could not believe all the wonderful things and technology that's there. And this new center will also be providing all these things and treatments that you're talking about.
Yeah.
Yes?
The Center for Cancer Care is it's a home for us for surgical oncology, medical oncology, and radiation oncology. In terms of the surgeons that are available there, we have surgical oncologists and general oncologists and breast surgeons and gynecological oncologists who are surgeons who are able to fight cancer in its full spectrum. For the radiation oncologists, we have these wonderful new machines that have come in there, and they're beautiful.
Oh, I did the tour. It's unbelievable.
It is. It's something from Star Trek.
Right.
You walk in there and you feel like you're walking through some kind of 21st century things that are going through. But it is really wonderful. So we're able to give kind of the newest technologies in terms of radiation therapy that are available for people. In terms of medical oncology, I tell you, when I walk through that center, I smile all the time. It is light, it is airy, it's open. People have this sense of peace. There's greenery that you could see. And then compared to our old building right now, which was a nice and lovely building, I have to tell you, but it's this new home just really makes up for it.
It does. And then going off of what you just said, you mentioned radiation. So compared to chemo and the other therapies, as you mentioned, how does radiation differ?
Okay. Chemotherapy are drugs that target or that go to cancer, and they go through your bloodstream to all over your bloodstream. Radiation therapy is they create beams of energy, and they do that in several different ways, and there are several different types of beams of energy. But these energies are focused to certain areas, and they're able to focus these areas. Now, you can't radiate the whole body.
Right.
That's too much.
Right.
And so what radiation is able to do is they say, this is where the cancer is, and they use computers, they use their technologies, and they use physics to say, all right, we're going to target these areas with radiation. We're going to use different radiations that's most effective, and we'll try not to radiate normal tissue.
Right.
And that's what we've come forward to in the past
Right.
few years. We're able to target radiation conformably.
Right.
Not just radiate this whole box that includes all organs, but
Right.
just say this is what cancer.
So you're
we're
really
able to do.
targeting and focusing on the cancer and that location.
Exactly.
And trying not to hit anything else that's healthy
Exactly.
around that.
Exactly. And radiation basically does is just goes in there, directly hits the cancer cell and kills it.
Now, technology has come a long way.
It really has.
It really has. Again, for those of you watching, our viewers, please, if you have any questions regarding our topic today on cancer and cancer treatments, it's just decisions of cancer treatments and where to go, what to do, and how to go about it, and to help make those decisions, please give us a call. Our lines are open. At the bottom of your screen is a phone number. So, Doctor, we talked about the next steps. We talked about how individuals can deal with some of this. But what are some of the questions I think that sometimes we forget to ask, preparing ourselves to go into your office, for example, to our physician's office and our oncologist? What are some of the questions that that individual should go in there prepared to ask? And maybe some suggestions in order to prepare that individual with that diagnosis on their next steps and what they're going to go in and ask their physicians. What are the things they should be prepared to ask?
I think the first question, that's really the critical question, is what type of cancer do I have? You'd be surprised how this simple statement is different from everybody. So if you have, people think that if you have a cancer that started in your colon and maybe spread to your liver, you have colon cancer and liver cancer. You don't. It's colon cancer that has spread to the liver, and we still call it colon cancer and treat it like colon cancer. So it's important to know what name of the cancer that you have. So I think that it's important to say, what type of cancer do I have? What stage is my cancer? So, and this is really important because outcomes are really related to stage. And how you treat somebody really depends on what stage they are, because each stage is somewhat treated differently for different cancers. Then, what are the outcomes to expect from my cancer, from my stage of cancer? And I think it's really important to have this discussion. Am I able to cure this cancer? Or am I not able to cure this cancer? If I could cure this cancer, what are my chances of curing this cancer? If I can't cure this cancer, how long am I expected to live? And it's important to recognize that we're not God. Nobody's God. I think science gives you an estimate. But I don't think that you have to recognize. So I think what the numbers that you get are estimates. When I first started treatment and I would give these estimates, and I forgot that people would hear these numbers and they think that's an absolute.
Right.
They'd go home and start Xing out the days on the calendars because you said X amount of time, and that's this.
Right. And you hear that all the time, where you have a patient who's actually been told they've got 6 months to get everything in order. And it's 6 years later, and everything is still fine.
It's you just recognize what you're told is an estimate by science, and that estimate kind of tells what the average number is, but there's always outliers on both ends, and you just have to be careful that may not describe you.
Dr. Aklilu, I've also heard that it's really important for your oncologist or hematologist to be involved in research projects. Can you tell me why?
I think it's important because we have not cured this cancer. And for certain cancers, we've come a long way, but for other cancers, it's just we're not there yet. And I think what being in research helps you out is that research is you're not a guinea pig with research. And that's
Which is a
fear.
misconception.
It really is.
Yes,
it really is. What research really is saying that conventional treatments for this cancer is woefully short of where it should be. We really need to improve this. And that means that we need to push forward and find a different modality that helps this. And what research does is pushes the envelope. And when you're pushing the envelope, that means that you have to know all the other studies that are ongoing at that time.
Absolutely.
And this keeps you up to date, and you know where to refer somebody that says, hey, this trial seems to be really promising. Instead of doing conventional treatments, let's try a research project that is pushing the envelope and that may have a better outcome than conventional treatment.
Absolutely. And it's really important what you said. I mean, there is a lot of misconception out there. The moment you mention research and trials, everyone believes that you're a guinea pig, and that's not the case. So it's very important that if your doctor is involved in research, that's a wonderful thing, and definitely something maybe you would want to ask your oncologist and hematologist.
Absolutely.
Dr. Aklilu, I still had all these things I want to cover with you, and our time here goes by so quickly. So on that note, I would love to invite you back so we can
Thank you.
continue this conversation, important conversation on cancer prevention and what you need to know, what you need to do, and how to get there, and what are the things you need to cover with your physician. So on behalf of my colleagues at Hispanocare and Illinois Masonic Medical Center, the Advanced Center for Specialty Care, I can't wait to see all the wonderful things that are going to come out of that place. And Dr. Aklilu, thank you for being on the show today.
And thank you for inviting me.
Thank you for our viewers for watching, and please stay tuned. There's a lot more information coming your way. Thank you. Thank you for watching, and I hope you took a lot away from this conversation as much as we really enjoyed sharing it with you. Until next time, stay tuned.